One of the most powerful weapons doctors have in the war on cancer isn't a type of medicine. Instead, it's a test. And not just one test, but many, which doctors can use to find valuable clues about your health, called biomarkers. Biomarkers come in many forms, but generally they're genes, proteins, hormones, and other molecules that can be measured with medical tests, such as when a doctor draws blood from a patient and has it analyzed by a lab. Doctors use biomarkers in a variety of ways. For example, some biomarker tests can determine whether you have a specific disease. One frequently tested biomarker indicates blood sugar level. If tests show that yours is too high, a doctor may diagnose diabetes. Measuring certain biomarkers can also help determine if you're at risk for a specific disease, which gives your doctor an opportunity to treat it early. For example, you probably get your blood cholesterol tested as part of your annual checkup. If your cholesterol is high, you may be at risk for heart disease, so your doctor will prescribe lifestyle changes and medicine to lower it. Biomarkers play an important role in diagnosing and treating cancer, too. For example, testing for biomarkers can help identify patients who have certain types of cancer. In 1991, Dr. William Catalona and his team showed that a blood test that measures levels of a protein in the blood called PSA could be used to screen men for prostate cancer. PSA was one of the first biomarkers to be widely used for cancer screening. It's also used to monitor how men with prostate cancer respond to treatment. Biomarkers can also be used to identify people who have an increased risk for certain cancers. In 1990, a scientist named Mary Claire King discovered that women who have an alteration or mutation in a gene called BRCA1 have an increased risk for breast cancer and ovarian cancer. King later showed that a mutation in the gene BRCA2 had the same effect. Within a few years, a test became available that could identify patients at increased risk for breast and ovarian cancers due to these gene mutations. Women who have these mutations can be closely monitored by their doctors. If you are diagnosed with cancer, your doctor may use biomarker testing to determine if you are a candidate for certain treatments. For example, some women with breast cancer test positive for high levels of a biomarker called HER2, which is a protein that makes tumors grow and spread. These women can receive an effective treatment called Herceptin or similar drugs. HER2 is just one of many cancer biomarkers that scientists have discovered in recent years. Identifying these biomarkers, which are sometimes called tumor markers, has allowed scientists to develop new types of drugs for treating cancer that are often used today with chemotherapy. Traditional chemotherapy destroys cancer cells, but it can also harm healthy cells. New generation cancer drugs are designed to prevent specific biomarkers or the proteins they produce from promoting the growth and spread of tumors. But because these drugs are more precise, they are less likely to harm healthy cells, which often means they cause fewer side effects. This approach to treating disease is sometimes called precision medicine. One group of new cancer medicines that targets biomarkers has an appropriate name: targeted therapies. These drugs work in two general ways. Just like normal cells, cancer cells need to receive certain signals to survive and grow. Some targeted therapies interfere with these signals by attaching themselves to molecules that carry them. Others block proteins called receptors, preventing cancer cells from receiving these signals. Doctors may also test for biomarkers to determine if a cancer patient is a candidate for a type of treatment called immunotherapy. The goal of immunotherapy is to help the body's natural defense, called the immune system, recognize and destroy cancer cells. Your doctor may suggest testing for cancer biomarkers to find out if a targeted therapy or immunotherapy might be right for you. Knowing whether you have one or more cancer biomarkers may also make you eligible for another treatment option. Enrolling in a clinical trial can give you access to new therapies months and even years before they're available to other patients. These advanced treatments can be life-changing, and some may even offer a cure. Give yourself the gift of hope by learning about all of your cancer treatment options.